Leuprolide is a medication used to treat certain disorders like endometriosis and uterine fibroids. When used for uterine fibroids, it is usually given with iron to help improve anemia caused by excessive vaginal bleeding. Leuprolide helps to reduce symptoms such as pelvic pain, painful or heavy menstrual periods, and abdominal bloating by shrinking the abnormal tissue that causes these symptoms. This tissue needs the hormone estrogen to grow and spread, and Leuprolide helps to decrease the amount of estrogen made in the body. The recommended dosage and timing for taking Leuprolide should be discussed with your healthcare provider. Before using Leuprolide, make sure to read the patient information leaflet provided by your pharmacist. This medication is administered by injection into a muscle by a healthcare professional, usually once every 3 months. If you are using this medication at home, be sure to learn all preparation and usage instructions from your healthcare professional and the product package. It is important to use this medication regularly to get the most benefit from it, so mark your calendar to keep track of when to receive the next dose. It may take at least 3 months for your symptoms to get better, so be patient and consistent with your treatment. If you have any concerns, consult your doctor or pharmacist. Some common side effects of Leuprolide 3-month syringe kit may include hot flashes, increased sweating, tiredness, upset stomach, joint/muscle aches, trouble sleeping, reduced sexual interest, and dizziness. Menstrual periods usually stop or become lighter when using this medication regularly, and they typically return within 3 months after treatment is stopped. However, if regular periods continue during treatment with Leuprolide, it's important to inform your doctor. Remember that the benefits of this medication outweigh the risk of side effects for most people. Serious side effects can include mental/mood changes, new or worsening bone pain, easily broken bones, and seizures. It's important to seek medical help right away if you experience any very serious side effects or signs of a serious allergic reaction, such as rash, swelling, severe dizziness, or trouble breathing. If you notice any other effects not listed here, it's important to discuss them with your doctor or pharmacist. Before using Leuprolide, it's important to let your doctor know if you have any allergies to similar drugs, as this product may contain inactive ingredients that can cause allergic reactions. Also, inform your doctor about your medical history, especially if you have high blood fat levels, mental/mood problems, vaginal bleeding of unknown cause, or seizures. Leuprolide may weaken your bones and increase the risk for bone loss if used for a long time. Let your doctor know if you have osteoporosis or if you have any risk factors for osteoporosis, such as long-term alcohol use, smoking, family history of osteoporosis and broken bones, or use of certain medications. This medication may make you dizzy, and alcohol or marijuana can increase this effect. Avoid driving or using machinery until you can do so safely, and limit alcoholic beverages. If you're using marijuana, talk to your doctor about it. It's important to avoid getting pregnant while using this medication, as it may harm an unborn baby. Consult your doctor about using reliable forms of non-hormonal birth control. If you become pregnant or think you may be pregnant, inform your doctor immediately. It's uncertain whether Leuprolide passes into breast milk, so it's not recommended to breastfeed while using this drug. Consult your doctor before breastfeeding. It's important to be aware that Leuprolide 3-month syringe kit may interact with other medications, which could affect how they work or increase the risk of serious side effects. It's important to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share it with your doctor and pharmacist. Do not make any changes to the dosage of your medicines without consulting your doctor. Additionally, this medication may interfere with certain lab tests, potentially leading to false test results. It's crucial to inform lab personnel and all your doctors that you are using this drug. If an overdose occurs with serious symptoms like passing out or difficulty breathing, it is important to seek immediate medical attention by calling 911 or contacting a poison control center. In the U.S., residents can call their local poison control center at 1-800-222-1222, and in Canada, residents can call a provincial poison control center. It's important not to share this medication with others. While using the Leuprolide 3-month syringe kit, it's important to have regular lab and medical tests, such as hormone levels, bone tests, and cholesterol/triglyceride blood levels. Be sure to keep all medical and lab appointments and consult your doctor for more details. Make sure to take each dose of the Leuprolide, 3-month, syringe kit as directed by your doctor. If you happen to miss a dose, contact your doctor or pharmacist for a new dosing schedule. Do not take a double dose to make up for the missed one. When storing the Leuprolide, 3-month, syringe kit, make sure to keep it at room temperature and away from light and moisture. It's important not to store it in the bathroom. Once the medication is mixed, it should be used right away. Keep all medications out of reach of children and pets. Do not flush the medication down the toilet or pour it into a drain unless specifically instructed to do so. Properly discard the product and it is expired or no longer needed. You can consult your pharmacist or local waste disposal company for guidance on how to dispose of the medication. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.